I started having trouble with my knees at least 10 years ago. I used to run and I did a marathon, and that really hurt my knees. The training is what really hurt, and I stopped running after that. But I was working and I was on my feet all the time, and they were sore, but you just get on with it. And gradually they got worse and worse. And when I walked at the end, my husband used to say, I rolled like a galleon in a thunderstorm. I would sway from side to side, and he wouldn't hold my hand in public because he got seasick because I was rolling so much. And the pain, it doesn't get worse gradually, it seems to get worse very quickly. And I got to the point where I couldn't stand for very long. If I sat and then stood, the pain of straightening my legs was terrible. And I actually worked in the NHS, and everyone said, well, you know, get your knees done. But there's no preferential treatment. You don't get any kind of special case. So I waited till I retired, and I thought, right, okay. I have actually been referred as urgent nearly a year ago, and I still haven't had an appointment date to see someone. And it got to the point that when you say quality of life, what it means is you can't plan to go anywhere. If I want to go shopping, I have to think, I'll go there and there and there, and then see how I feel. And if I feel okay, I can go there, or I might have to go home. And that got worse and worse and worse. So when they say quality of life, it means that you really have to plan your life like that. And so I thought, right, and I was going to go and have my knee done, well, one knee, and then I need them both doing, going to have them done privately in Cardiff, where I come from. And that's when I started looking at where to go. A year ago, I had injections in my knees. I'd lost weight. I tried everything they tell you to do. The injections worked for about 6 weeks. And I thought, okay, let's look at having them done. And I started looking at having them done privately. And we have a very good private hospital in Cardiff. And I saw how much it was. And I thought, I like to do a lot of research, really do. And I was looking at going abroad, and I cast my net very wide, and Lithuania came up very highly recommended. So I waited and waited, and it got to my referral, still no appointment. In May, I had more injections in my knees, didn't do anything. And I thought, right, that's it now. This is the last trick. We have got to go for surgery. So I looked at Lithuania again, and I was also looking at S2 funding. And I saw that Fi Clinica would do some of the paperwork for me. And I applied to my local health board, and they said no. By this time, I'd seen Dr. Shurka, or seen about him, and I thought, I'm going. And I looked at the spa here, UPA, and for the price for my knees, I've got a lovely operation and my rehabilitation. In Cardiff, it would have just been the operation. I'm basically getting both knees done for the price of one. So I came on my own from Cardiff, and it's been brilliant. My first impression of Fi Clinica was that it's a very professional establishment. I arrived before 8 o'clock in the morning on my day. I had arrived in Kaunas 10 o'clock the night before, and the receptionist took me for my blood tests. The doctor did my x-rays. I was very impressed, and very soon afterwards he talked me through what he was going to do, what he'd found on my x-rays, and in fact found that I had damage to my knees caused by trauma. I had a fall a few years ago, which explained a lot, but he spotted it on the x-rays. And so not long after that, I was in my room, in my gown, and then walking down the corridor to the theatre. It was lovely. It was very professional. The staff were really lovely. After the operation, I didn't know what to expect. And I was frightened I would be a bad patient and crying, but I wasn't. I was surprised at how little pain I had, because the pain in my joint before the operation was bad. And afterwards, I could swing my legs out. Okay, I was on painkillers. The staff were lovely. Anything I needed, the food, I could choose what I wanted for my meals, and there they were beautifully presented. And then the physio came in, the doctor came in and checked my range of motion and was very pleased with me. So I was a good patient, I hope. And everyone was very kind, and I was up, I had a walking frame to go to the bathroom, and I was pleased with myself that I could do as much as I could. I didn't think I would get that much done, and before I knew it, I was here in UPA. It just went very, very quickly, and I can't believe I'm now 8 days. It's gone very well, so I'm very pleased. I'm glad I came here, because today this is my job. Being in UPA is like being in a club. We're all together, and you see us with our sticks marching round from one place to the next. We have massage, physio, light therapy, cold therapy, and then you have time to rest, which you need. And we have meals, so we're looking at our watch to see, is it dinner time? And you can concentrate on getting well. There's a nurse 24 hours a day, which is wonderful. And at the end of the phone or just outside the door, and you would not have that at home. And I certainly wouldn't have had that at home, at hospital. I would not have got that self-service at home, even though I live very close to my doctor. Booking to come to Fi Clinica and to UPA was very straightforward. You have someone to talk to at the end of an email, and they will deal with you. I flew Ryanair from Bristol, which you do all online, is very simple, budget airline, no frills, fine. They've been very good. The transportation between Kaunas and here has been all laid on, ready, very straightforward. And I will be back in 6 months and do it all again. If you're in the UK and need a new hip or knee, and are considering going private and have the funds one way or another, definitely for value for money, for service and for aftercare, come to Lithuania.